Hello, my name is Neil Browning, and this presentation is on the socio-ecological model, specifically community-level change, with our intent of increasing influenza vaccination uptake in Jefferson County, Kentucky. Community-level change background. Community level is the fourth level of the socio-ecological model, which was a model that was developed as a framework to understanding how various personal and environmental factors influence people's lives. Orlasky defines the community level as the groups of informal networks to which people belong, as well as places where relationships develop, which can include such places as work, school, and home. Community level consists of the local culture, which includes both the natural and built environments. At the community level, change happens as a result of targeting the structures, resources, and practices of places that people frequent in order to achieve a positive health outcome, such as vaccination uptake in this case. Socio-ecological model. Community economic impact. Medical expenses directly related to influenza infections cost businesses $10 billion annually. Lost earnings to businesses due to decreased productivity from the flu added an average of $16 billion per year to costs. Community mortality and morbidity. For the 2018-2019 influenza season, there have been 6,611 confirmed cases, of which 6,490 were of the type A strain of influenza in Jefferson County, Kentucky. There have been 27 influenza-related deaths in Jefferson County during the current influenza season. The average age of confirmed cases was 28 years old, with 47% being male and 53% female. The elderly, the very young, those with chronic disease, and those with compromised immune systems are most susceptible. Influenza is the sixth leading cause of death among American adults and is the causative factor in 1 of 20 deaths in people over the age of 65. Community-level change. Influenza preventative measures. Immunization provides the best prevention against seasonal influenza. Only 41.8% of adults receive an annual immunization, and this is well below the immunization goal set by Healthy People 2020 of 70% for those aged 18 or older. Community change, evidence-based practices, EBP. The CDC has stated that evidence-based practices most likely to increase influenza vaccination uptake are those such as educational influenza campaigns, role modeling by administration and staff, improved access to the vaccine, and measurement and feedback. Community change interventions, evidence-based practices, EBPs. Our group has chosen the utilization of 3 proven EBPs to increase community influenza vaccination uptake in Jefferson County, Kentucky. The EBPs selected to affect community change are free, flexible vaccine access in such areas as work sites, schools, churches, and stadiums and arenas. Media dissemination of influenza information to include social media, Facebook, Twitter, Instagram, and informational posters placed on buses, billboards, stadiums, or any place people congregate. And employer-mandated influenza vaccination as a condition of employment. This would be done at businesses with more than 25 employees. Community change limitations and obstacles. Low health literacy. Health concerns such as Guillain-Barré syndrome, misinformation, misconceptions, inconvenience, needle phobia, personal religious beliefs, and labor unions opposing the immunization mandate at businesses. Here are my references, and this concludes my presentation, and thank you for watching.